I'd like to welcome everyone today for our last of our 4 webinar series on the Medical Research Future Fund. So we dedicated the month of June to the MRFF and everything you need to know to optimize your funding success. I'd like to just tell everyone that the the webinar is recorded and all the recordings will be available on the Health Translation SA website. And I'll be posting I'll be sharing a little Twitter link, and on our website as well, there'll be a link to all the recordings. Before we start, I'd just like to acknowledge the Ghana people as the traditional custodians of the Adelaide region. We recognize the Ghana people's cultural, spiritual, physical, and emotional connection with their land. We honor and pay our respect to Ghana elders, both past and present, and all generations of Ghana people now and into the future. What's the Spotlight series? So, this is the last webinar of 4, but still for people who are just joining us today. The Spotlight series is a whole month that we dedicate to a specific topic. This month was the Medical Research Future Fund. So we had 4 webinars. We share online resources through our social media platforms at Health Translation SA, so Twitter and LinkedIn. And we have a whole heap of resources that we have shared. So links to the MRFF website, links to the HTSA MRFF working group, what they do, how they can help you as researchers, and potential publications and information around the MRFF. Today's webinar is all on the tips and tricks from research support offices. So we'll hear from speakers from the University of Adelaide, UniSA, SAMRI, and even Health Translation SA. Our 4 panelists are part of the Health Translation SA MRFF working group. And before I start the actual body of the presentation, I'd just like to remind all the attendees that you can use the Q&A function at the bottom of your screen, and that there'll be a specific Q&A period after the 4 panelists have answered each of the questions. Before delving into today's topic, I just want to do a quick overview of who Health Translation SA is. Why do we organize these type of initiatives? Our purpose is to accelerate the translation of research findings into healthcare practice and policy, and to increase whole of system research translation capacity to improve the health of all South Australians. So the way that we work is by engaging with stakeholders, and we act as independent catalysts to link education and training areas to the policy area, to the health services, to research. And so we broker to mobilize collaborations to address major health system challenges. And the way that we work is that we believe that research translation, it's a mindset. So it's not just a phase in your research project, it's how you structure your research project. So you have to think about translation all throughout your research project. And that's a little bit how the MRFF grant opportunities are as well. It's very translation focused. What's the ultimate problem you're trying to address, and who are you going to involve? Who's your next user? Who's your end user? And yes, how are you going to involve them in your project? So without taking more time from today's session, I'd like to introduce our panel of speakers. As I mentioned, all 4 panelists today are part of the Health Translation SA MRFF working group. And they all are part of research support offices who support researchers to apply for grants. We have Dr. Nicole Moore from the University of Adelaide. She's worked in cancer research for many years. She's a research grants officer in the health grants team in research services at the University of Adelaide, where she's responsible for post-award management of health-related research grants across the university. We have Dr. Leanne Britcher from UniSA. She's a grant developer for major initiatives, responsible for coordinating opportunities for strategically important research projects, including the MRFF. She brings understanding on how the MRFF schemes have developed over the past few years, and they're not NIHR secrets. we have Dr. Rebecca Perry from HTSA. She's a senior project officer with us, where she leads and supports statewide MRFF projects. She brings a wide range of experience to the team as a result of working as a clinician, a researcher, and more recently as a project and community engagement manager. Finally, we have Dr. Carol Holden, who's joining us from SAMRI. She's the senior project and MRFF development officer in the SAMRI research office. She joined SAMRI in 2017, having come from Monash University, where she was CEO of Andrology Australia for 15 years. Her role is really to support researchers in the identification of MRFF funding opportunities and the development and successful submission of applications to the MRFF. So what I'm going to do now is I'm going to ask each panelist one question that they need to answer within 5 minutes. And then we'll open up to the audience if they have any questions for our panelists. So I'll start with Carol. Your question, I think you wanted to share a slide with us.
Yes, that's right.
I can stop sharing my screen and you can share yours. While you set up, I'll ask your question. So the question I had for you was, what is the most common question you get asked about for support on MRFF grant applications?
Okay, well, thank you, Augustina, and thank you for this opportunity. And I suppose, like other research officers, we get asked many questions when MRFF schemes are called. But I chose this one as I think I wanted to just talk through very briefly about what to think about if you want to think about repurposing an application that you may have put to another, say, an NHMRC scheme, if it's applicable for the MRFF. Now, I know this might be a little controversial because we have heard in previous sessions that reviewers can clearly see when there's a repurposed application, so we have to be careful about this, but I think there are some steps that can be considered. And I think it's also, we would encourage people who haven't put in an application to the MRFF to do this, because it's very difficult to write an application from scratch when you're new to the whole experience. And that's when you often see study design gaps, and that will actually make a difference on your assessment criteria. So if you already have a proposal, it might be worth thinking of repurposing it for a scheme, but I'll go through when to do that and when perhaps not to do that. So firstly, quite obviously, it needs to be consistent with the MRFF principles of translation, collaboration, and sustainability. And some discovery scientists might say, no, that's not for me, I'm just bench work. But often those proposals are also framed in terms of better health and better health outcomes. So there may be opportunities, and it might be more of a long-term plan, to actually look at a broader team of clinicians and health services researchers, where you as the discovery scientist may not be leading it, but actually an important part of the team, because you're using your proposal to sort of underpin the rest of the application. So there's always that opportunity that might be worth thinking about. But if you are consistent with those, if your work is working in that space, then clearly the first thing is to ensure that your objectives and outcomes of your proposal do match the scheme that you're looking at. And that is quite easily to find in the section 1.3 in the guidelines, which is consistent across all of the guidelines. And the objectives and outcomes can be very specific. Making sure that they're aligned is obviously very important. But sometimes there's schemes like the current early and mid-career researchers and the clinician researcher schemes, where the objectives are a little broader, and you might be able to, again, align your application to that scheme. The other aspect of the guidelines to check that you're still within the scope is section 1.2 and looking at the sort of priority, the MRFF priority in which this scheme sits. And this can give you a good insight into what the MRFF is actually trying to look for, and also give you some insight into who the reviewers might be, because they'll be aligned to what the MRFF is looking for. So again, it's worth looking over that section carefully and seeing how your application fits. And sometimes it's about rewriting it aligned to that priority and aligned to what the reviewers might be looking for, giving that information in that section. That section will also tell you, may give you insight into your potential competition. So if you're working in the area of chronic disease and there's a lot of focus on a particular area, say cardiovascular disease, and you're not quite in that, you'll know that most of the applications will be focusing around cardiovascular disease and it may not be suitable. But if you've got an innovative idea that is something new to that area, again, it's worth thinking about whether you can work the application up and make a convincing story for the reviewers. And finally, sometimes it's good to have a think about the MRFF in terms of a long-term strategy. So you might have applications that you've used in other schemes, like the NHMRC, and it might not be relevant for a current call, but it's worth thinking in the longer term, because the MRFF has now the incubator and accelerator scheme. So there's opportunities to start small with a feasibility study and an incubator scheme, and then look to the longer term for a larger accelerator project. So I hope that gives a little bit of thought about repurposing. Like I said, we would encourage it, but we would work closely with researchers to ensure that it fits the scheme. Thank you.
Thanks so much, Carol. That was really insightful and a really good, good answer to that, whether you can repurpose an application for the MRFF. I'm just going to ask you to stop sharing. Yes. And I'll just put up my old screen back up, and I'll move on to Nicole. My question for you is, what is your #1 top tip for researchers applying for MRFF funding?
Yeah, so thanks, Agustina, for inviting me to be part of this panel. So my role is in the strategic research team at the University of Adelaide. So I help a lot of people with health-related research grants and trying to help them through the early stage development of their applications. And a lot of this is MRFF. So for me, one of the things I often tell researchers as the first thing to do when they are preparing an MRFF application is to get their team together. So this obviously includes the chief investigators, but also the associate investigators and all the other people that you need to be able to achieve the goals of the project. So in terms of chief investigators, there's usually some sort of eligibility rules on how many applications you can be named on as a chief investigator. So it's important to check the guidelines or check with us as to what those rules are. Some schemes have restrictions on what types of people can be named as chief investigators. So for example, there's the current EMCR scheme that's open. So all the chief investigators need to be either ECRs or MCRs, and that's different depending on which stream you are applying to. So there's a bit of strategy there on how you compose your team for that one. So getting all the CIs nailed and making sure they're not on any other applications is a really good place to start, and lock them in, get them into your application in Sapphire as soon as you can. And that will mean they know they're named on this application and that they hopefully won't put up their hand to be involved in anyone else's application. We do have the ability in Sapphire to check if your CIs are named on more than one application, but it's not 100% reliable. It requires the CIs to actually have accepted an invitation to another application before we can see if they're actually named on it or not. So at any point in time, if the CIs haven't done that, we can't actually check. So it's best for the CIA to be communicating with their team to discuss who is named on what applications, because otherwise if CIs are named on more than one application and they're not supposed to be, both applications will be ruled ineligible. Associate investigators you can also include as well, but just be sure that you are not supposed to discuss their track record and experience when talking about who's doing what for the project. So the AIs are kind of there for an advisory role and in some cases like a mentoring role. And also some schemes, not all MRFF schemes are administered by the NHMRC through Sapphire. There are other schemes that are administered through DISA, and they use the Business Hub portal to create the applications. And some of these DISA administered schemes do not allow associate investigators at all. So all named investigators are chief investigators for those particular schemes. So something to keep in mind if you're applying through there. The team composition is really, really important. You can name obviously scientists, but then also clinicians can be named as CIs or AIs. You know, this obviously includes doctors, but also can be nurses and allied health professionals. They like to see a mix of junior and senior researchers. They like to see a diverse team in terms of like gender and ethnicity and expertise. They also like to see consumer advocates. So some applications will name consumer advocates as chief investigators, and this is entirely appropriate if they have a specific role in completing the project. Health services professionals, health economists, statisticians, commercialisation experts, all people like that are good to be able to have on your team to ensure that collectively everybody named on there can complete the project. And so if you get your team together early, then you can be requesting all the necessary information required from them, such as their top 5 publications and their track record information. So they can be off preparing that in the background while you're working on other parts of the application, and it won't be such a rush to get everybody get their information to you right at the end. So that would be my top tip for people starting an MRFF application.
Thanks, Nicole. That's really informative. Yeah, so get your team together early on and ensure there's a variety of people in it, and ensure that your CI isn't a part of another grant as well. That's a good one to remember. My next question is for Rebecca. Can you tell us what role can HTSA play to increase South Australian success in receiving MRFF funding?
Sure. So as you said earlier, Agustina, we're HTSA is an NHMRC accredited Advanced Health Research Translation Centre, which is quite a mouthful. But that aligns, I guess, the way that we work is to work with our partners and our stakeholders, as you said, as an independent catalyst and broker to mobilise collaborations, and particularly around accelerating the translation of health research into health practice and policy. And so that aligns really nicely with the intent of the MRFF scheme. So, you know, there's a nice alignment, and it makes sense for us to be supporting MRFF applications that are going through from South Australia. We have 11 partner organisations. So I'll just list them quickly. So we've got the Aboriginal Health Council of South Australia, CSIRO, Torrens Uni, the Commission on Excellence and Innovation in Health, SA Health, the 2 PHNs, so Adelaide PHN and Country SA, and then obviously Flinders Uni, Adelaide Uni and Uni SA. So through our partner organisations, we're able to foster really good collaborations and I guess make connections between work that might be going on with one research group at one institution that might be able to identify really beneficial collaborations that could result in really competitive and innovative MRFF grant applications. So you mentioned that we coordinate the SA MRFF working group. So that's a really nice way to bring representatives from our partner organisations to share our learnings, to share tips and tricks, I suppose, that we can all benefit from as a state to improve the number of MRFF applications that are going in and the quality of them, and then hopefully the overall success rate. I guess more specifically, as an organisation supporting individual grant applications, so we can help with grant development support, quite different to the type of support that teams would get from their institutional research office, but more around particularly looking at the project impact section, providing some advice and input around how that's articulated and structured, looking, I guess, applying an implementation science lens over the application, and making sure that it's really ticking those boxes. Like Carol said, the key intent behind the MRFF around that really strong translational focus. We can also assist with connecting teams with potential partners and providing letters of support either from HTSA or potentially through partner organisations. And I think really importantly as well, we can assist with consumer engagement. And Agostina and I have been working closely together with a few requests that we've been getting recently from researchers who have identified that they're really wanting to engage with consumers. And so we don't run the focus groups, for example, for you, but we can certainly help connect teams with consumers through our community interest register. So I think they're the main points or the main types of support we can offer around grant development support. And I always speak with my colleagues from the MRFF working group if the team is contacting us around because they're interested in applying for an MRFF application, then I'm always encouraging teams to make sure that they also contact their institutional research office, just so we're all on the same page. I think that's really important. And yeah, I think I might leave it at that. But yeah, three things I think of: the working group, the individual grant development support we can provide, and then also support around consumer engagement and also capacity building in that space, which Agostina is very actively involved in as well.
Thanks, Beck. That was really informative. And you're right, there's so many ways HTSA can help in applications that's beyond or complementary to what institutional research support offices can offer as well. And so finally, I'm going to go to Leanne, our last panelist for today, before we open up to the Q&A session. Leanne, my question for you is, what is the most common mistake you see across MRFF grant applications?
Thanks. First of all, I've realised the strong language about mistakes. Let's not call them mistakes, as I think we should all recognise that the MRFF program has evolved from very little direction of what they're about to perhaps we're starting to see a lot more direction and guidance, particularly around the key measures of success. So I think it's still this constant lesson learned as we go along. And sometimes I guess we use the word mistakes as a research office, like we're telling children off for being naughty for not reading, and then realising that each guideline's changing and evolving. The information we've had over time keeps changing as well. So that is something I think we just need to keep in mind with the MRFF. And also that reminder that the MRFF is administered by a number of organisations. They don't roll out the schemes themselves. That's at the moment that you get the NHMRC and of course DISA, the Department of Industry, Science, Energy and Resources. And they were likely asked very early on to roll out funding schemes using their systems and guidelines and templates, which they didn't and possibly still don't meet all the intentions of the scheme. So the key lessons I think I've learnt now is trying to be more agile to respond to slightly changes, and being aware of each of the schemes, be aware that each scheme is different, and then even the streams within each scheme are slightly different. And that, I think, goes back to the point that Carol made about being sure that we're meeting the objective and the intent of each scheme. There's these slightly different checkboxes popping up in the application, different criteria and different even terms of the grant conditions that could be available, which is similar to any grant. Of course, they're always different, but I think when we look at MRFF, we're probably thinking an MRFF grant like an ARC grant, but MRFF is multiple schemes. Two examples that I think are good to watch. The key, what I think I've picked up from a key change, but also perhaps a tip, is that the Chief Investigator capability and capacity statements for the grants administered by the NHMRC. They've evolved from being the older NHM, I call NHMRC style, with many items to address, to focusing on the achievements and impact. And I'll put in the chat an excellent resource that Health Translation have linked out to, which is a guidance around creating an impact CV. It's not for putting into the grant, but it's a great resource for tips around thinking about all your areas of impact. The other perhaps confusion or issue and understanding now is this introduction of partner organisations versus participating organisations that in various rounds caused us no end of confusion and tension about being compliant. But again, I think that goes back to Nicole's tip around gathering partners and participants early. So we're understanding your difference between your participating and your partner organisations and the letters that are to be collated. So overall, it's lessons learning, being agile. Again, you just have to really understand what each specific scheme is asking and being about.
Mm-hmm. Thanks for that, Leanne. That was really useful as well. And yes, I'm looking forward for you to put that little link in the chat box with regards to the impact CV, as you mentioned, as you called it. I'm opening up the question and answer period now of the webinar. So if our participants online would like to ask a question to either one of our four panelists, now is the time. I'm just going to stop sharing and so we can have a bit of a... Now, would anyone like to raise their hand or ask a question or on the chat? Now is the time. Hand up. No, I have a question. Let me find it. So if I'm a researcher considering to apply for MRFF funding, when should I contact the research office? That's to any of the 4 panelists.
I can answer first if you like. As early as possible for us, because we help support our researchers in developing their applications. So even if it's just an idea and you've seen a call come out, you know, you might want some advice on, do you think my project fits into this? And, you know, let us know what sort of support you need, and we'll try and help you as much as we can. Obviously, we get people contacting us at a range of different times, often very shortly before the deadline, and there's not as much we can do to help support you at that stage. But if you get in touch early, our email address is mrff@adelaide.edu.au, and I'll pop that in the chat. Then yeah, we can do our best to help you.
Thanks, Nicole. Did anyone else want to answer or add anything to that? Or
I was just going to say exactly the same as Nicole. The sooner the better. We can provide much more support than later on, but you know, we'll always provide the support, but as Nicole said, it's more comprehensive when it's earlier.
Thank you for that. We have a question in the chat from someone who says, I have a question about budgets. The MRFF guidelines for the stream we are applying for stipulate that overheads, etc., cannot be included in salary packages. What is the policy from the university point of view regarding costing overheads and uni levies in your budget? So I don't know if any of you 4 would like to answer that one.
I can attempt to answer that one. So for MRFF schemes administered by the NHMRC, for salaries, you need to include the salary levels, those PSP packages that are indicated in the guidelines. And we all know those PSP packages do not actually cover a full salary, and you need to have another source of funds for that salary. So in that situation, if you don't have other funds, then it would be worth talking to your head of school to see what they can come up with. In terms of costing overheads, I'm not entirely sure what you mean. Do you mean indirect costs or salary on costs? So salary on costs obviously can't be included in the budget for NHMRC administered schemes, and overheads like indirect costs are also not allowed to be included as indicated in the guidelines. It's slightly different for the DISA administered MRFF schemes. You can actually request and budget entire salaries for those ones. So you can include the full salary plus salary on costs. So that's just a point of difference between those 2 different types of schemes.
Thanks, Nicole. Does anyone else anyone else like to ask a question either via microphone or in the chat? I've got another question for the panel. I'm used to applying for NH and MRC funding. What are the differences or the nuances that I need to consider when applying for MRFF? So what are the differences with NH and MRC funding?
I don't think you should actually even ask that question. Sorry, that sounds really blunt. MRFF is not NHMRC. Yeah. The problem we have is that it's administered by the NHMRC. So the MRFF are using them as, say, subcontractors for their systems and look. Okay. However, there are some interests because they're both health translation, and you may be able to use obviously your project, but don't try and map the differences. Okay. Look at each scheme, exactly what each scheme is asking for. Yeah, someone else may have that opinion, but another opinion.
Thanks for that. Any other questions from the audience? Has anyone applied for MRFF what's been your experience with your research support offices? Would you like to ask something to our panelists? I'll ask another question that I had in my list of extra questions for the panel. I feel some of these topics have already been addressed, but maybe you can just add a little bit more detail. So how could I justify including clinicians as investigators if they don't have a competitive track record?
Again, this might be different across research offices, but the MRFF is about translation, and often that does require health services and clinicians. It's also, MRFF is not so much about track record, it is about the capability of the team. And so if you need people to facilitate the implementation, you'll need them presumably on your team. I mean, we have applications where I think Nicole or Leanne mentioned that, you'll have consumers on the team and they won't have any track record. So I think it has to be taken in the context of how does the team makeup actually contribute and support the study rather than necessarily the individual track records.
Thanks, Carol. Yes, and that's the gist that I had gotten from the panel's I guess contributions. I think Leanne mentioned that earlier as well, as about their capacity and their achievements, not necessarily the actual publication track record.
I think that's what I'm seeing, the messaging evolve more and more, and I have heard a clinician advise that they are looking for demonstrating that they're a really important part of the team and something that's different. I guess that's probably why we've now only going to listing top 5 publications, and again why that capacity statement, capability statement is changing, has changed more to focus on impact as well.
That's what I was going to add as well, Leanne, just that capacity and capability statement is a really good opportunity to be able to perhaps illustrate why someone who may not have an amazing track record but has demonstrated impact in other ways, you can articulate that there. And then I suppose also in the relative to opportunity section, there is an opportunity there to just explain any career interruptions, and that could be for various reasons, including clinical load, as I understand.
Thanks, Beck. There's a question from the chat room. Can the infrastructures, for example, tech bioinformatics platforms, make up for the team expertise areas that are lacking?
I can have a go at answering that one, and I think it would depend on the application that you are submitting. You do need to address the team expertise. There's a whole section in the application where you have to indicate the expertise of the team and how they're able to achieve the goals of the project. So I would definitely choose people who can collectively do that, but whether the infrastructure that you are using is enough to make up for that, I would have to have a look at the application. My initial thought would be probably not, but it would be on a case-by-case basis, I think.
I think we would just reiterate again, is it an important part of the outcome or objective of the project? And the team will change depend on the scheme and the objective of the project.
Thanks, Leanne and Nicole. Is there anyone else who would like to share something on the chat or raise their hand to ask a question? Okay, we have another question here from the chat. It's about the cardiovascular health grant. So Amanda asks, are applications focused on preventing cardiovascular disease eligible under maybe stream 1, topic C? So for example, the application focuses on increasing physical activity and decreasing screen time in kids.
I think we'd probably all have to go and have a look at the guidelines and look exactly what stream 1 topic C said. If they, yeah, so I mean, unless I look it up and know what your research proposal is about, it's hard to really know whether you'd be eligible. But there's sometimes the nuances. But again, looking at the intent. Sorry, I'm not going to be able to answer your question directly unless there's no more about the grant in front of me. Sorry.
Would anyone else like to add a question? Oh, someone put the stream 1 topic C, so supporting integration of individual and population approaches to optimize cardiovascular disease and stroke prevention. I think this might be a case for reading the proposal and
yes, you definitely need to understand what your proposal is to then understand if it's meeting that, because there can be lots of nuances in that. So we'd always sort of look at the proposal and then look at the objectives if we were trying to see about a repurpose.
Okay. Let me see if I have any other questions for you. So can research, this is a really basic one, and it's, probably already answered this. Can the research support offices, help obtain letters of support for, in your applications?
Yes, definitely. That's what we would do. Yes.
Yeah, so we do as well. We have a template that we send out to people with the required information. And also if people are named on applications that are led by other institutions and they require a letter of support from us, then we can also facilitate that. So yeah, definitely get in touch if you need one of those.
Thank you. Thanks for that. I'll do one last shout out to the audience. If anyone would like to ask a question, maybe regarding their own application or, what process they should follow to contact their research support office, or if they have any specific questions. If not, I'll conclude the webinar. Yes, so I think that's going to conclude today's webinar. If no one else has a question in the next couple of minutes, I'll just share my screen one last time to tell you a little bit about next month's, just change my slide, about next month's upcoming Spotlight series. Before I say that, I just want to thank our amazing panel today for really giving us their insights into how research support offices can assist researchers in applying for the MRFF. I think it was a really well-rounded conversation and really detailed in what type of support is available and what things to take into account with regards to building up your team and how to follow the intent and the purpose of the grant application. So I'd like to thank Leanne, Nicole, Rebecca, and Carol for their time today. So this was the June Spotlight series. Our next Spotlight series will be in October, and it will be everything about consumer engagement. So we'd like you to join us to learn more about some example case studies to showcase best practice, have some consumer testimonials of people who have been involved in research, learn more about specific engagement skills, and maybe learning more about what other translation centers like HTSA are doing around consumer engagement and what resources exist out there to do consumer engagement. Letting you know as well that all of the 4 webinars that we've had over this month have been recorded, and all of the recording links are going to be available on the Health Translation SA website. So again, I'd like to thank everyone for joining us over the month, and all of our speakers who've spoken during our webinars. If you have any questions or would like to get in touch with Health Translation SA, please contact us on our inquiries inbox or give us a ring at the phone number on your screen. And that is it. I'll let you all go, and I hope you enjoyed the Spotlight series and get to use some of the resources that we've shared on our website. So thank you.